Good afternoon. My name is Michael Carey. I'm the chair of the board of the Housing Agency. Ministers, special guests, colleagues here, both here present in the building with us and also in large numbers on our live stream. Welcome to the launch of the National Office of Housing First. The National Office of Housing First is a new national directorate based in the Housing Agency under the leadership of the newly appointed National Director, Rob Loth, who's in his second day today. First day has been great, second day, awaiting great results on his third day. This afternoon, we have a number of speakers here to mark this occasion and to speak about Housing First. Firstly, to officially launch the Housing First National Office, we're joined today by Darragh O'Brien, Minister for Housing, Local Government and Heritage, and Frank Feehan, Minister of State for Public Health, Wellbeing and the National Drug Strategy. Thank you both for being here today, but also thank you both for the support of and the engagement with the Housing Agency in its work, especially in the area of homelessness, and particularly in the establishment of the National Office for Housing First. So can I ask each of you to say a few words? Minister.
The senior minister has asked the junior minister to go first. Thank you. Ladies and gentlemen and invited guests, I want to warmly thank the Housing Agency for the invitation to jointly launch the Housing First National Office with my colleague, Minister O'Brien. I strongly support the establishment of a Housing First National Office to drive the achievement of the target of 1,300 tenancies. And Housing First is a unique collaboration between the Departments of Health and Housing and puts people who are on long-term homeless at the centre of government policy making. And that requires our public services to prioritise and respond in a person-centred way to those with complex health and social needs. Housing First is a housing model that aims to eliminate homelessness for people with a history of long-term rough sleeping who have complex needs around substance use and mental health. It provides direct access to permanent housing together with intensive housing and health supports delivered mainly in the person's new home. The Housing First National Office builds on an excellent collaboration between the Department of Health, the HSE, and the Department of Housing and local authorities. It is my intention that a dedicated Department of Health HSE person will be part of the National Office. And the HSE continues to contribute to the development, review, and enhancement of the programme in the following ways. Key members of the National Housing Implementation Committee, involvement in early stage development of the programme, including programme design and joint review of initial proposals with GENIO and National Director at the time. Provision of training, development and international events in partnership with GENIO and the National HF Director. Facilitation of networks and integrated pathways to care across agencies, both external and internally within the HSE. Contribute to the development of the Housing First Manual. Review and monitoring of the Housing First initiatives across the 9 regions in partnership with GENIO and the National HF Director, and support for the National Housing First Evaluation and Action Research Programme, and development and pilot implementation of a Housing First health monitoring tool, which will be rolled across all regions, 9 regions by the end Q2 2022. I would like to acknowledge the contributions made by the HSE, and in particular Joe Doyle and Marieka Altena of the HSE's National Social Inclusion Office. I want to acknowledge the pioneering approach of GENIO and the Service Reform Fund in promoting Housing First in Ireland and in providing training and support for the numerous organisations implementing Housing First, including Voluntary Homeless Service. Housing First is an expression of the government's determination to break the vicious cycle between homelessness and ill health. As a social determinant of health, being homeless worsens the physical and mental health of those affected and makes people more vulnerable to problematic drug and alcohol use. And furthermore, homelessness undermines the effectiveness of healthcare services, as it creates additional barriers for people in accessing treatment in a timely and integrated manner. From a health perspective, Housing First is Sláinte Care in action. With the right care, be it mental health, physical health, and our addiction supports, in the right place, which can be a person's home, at the right time, now, and not dependent on a waiting list. Providing people with a home of their own is the critical ingredient that enables the effective and timely delivery of healthcare services. It allows healthcare professionals to put in place the wraparound supports that people who are long-term homeless require urgently. Housing First is therefore a win-win situation for the health services. It also reduces pressure on emergency departments and makes services such as the Hep C programme more effective, as people who are homes are better able to follow treatment plans and to attend outpatient clinics. As Minister with responsibility for the National Drug Strategy, I am very concerned at the link between homelessness and the drug and alcohol addiction. I have prioritised the development of integrated care pathways and harm reduction responses for the high-risk drug users for the remaining 4 years of the strategy, 2022 to 2025. A key indicator of this will be a reduction in the incidence of drug overdoses and the high numbers of drug-related deaths. By offering a case management response to Housing First clients, problematic drug and alcohol use can be reduced and a pathway provided towards rehabilitation and recovery. Earlier in my tenure as Minister of State, the Minister of Health, Stephen Donnelly, TD, and I met with Darragh O'Brien, TD, Minister for Housing, Local Government, to express our joint commitment to assess and commit dedicated multi-annual funding to meet the health needs of people who are homeless. The Department of Health has delivered on this commitment with additional budget allocations of 11 million in 2021 and 10 million in 2022. And in addition, later this year, there will be a British-Irish Council symposium between the drugs and alcohol work sector, which I chair, and the housing work sector on working together to address the healthcare needs of people experiencing homelessness and substance use. The Department of Health and the HSE support the establishment of a Housing First national office, comprising a national director and a support team, as well as representation from departments and organisations. And the department has prepared proposals for funding under the HI fund and look forward to a positive outcome. Finally, I want to acknowledge the commitment and dedication of the many officials in the HSE, community healthcare organisations and local authorities, together with voluntary sector and NGO partners, and in delivering Housing First tenancies for people who are long-term homeless across all regions of the country. And without your support, Housing First will probably remain an aspiration, not a reality. Finally, I just want to thank my colleague Darragh O'Brien and Stephen Donnelly. It's a year and a half now since we ended up in the Customs House. It was our first collaboration, and I think it's first collaboration of many. And I think that's when you have departments working together, agencies working together, and people working together, that we can help solve a very, very difficult problem. But today is a good day, and is a day we should be positive of. Thank you very much.
Gurmin Margaret Frank, agus Gurmin Margaret Quilligina on Quira Pertivsha Dom con Lauert live Ternona and you, and just thank you very much for the invitation to speak to you here this afternoon. I want to thank Minister Fian. Frank is a good friend of mine and a very practical person, and thank my colleagues in my own department and indeed the Department of Health and all our agencies, our NGOs. And if I could say, it's a real pleasure to be here at the launch of the Housing First National Directorate, and it shows from when a pilot moved forward into implementation success, and I'm looking forward to listening to Gary now shortly as well to give his personal insight. I really want to thank you as well, Gary, for being with us today to actually tell us what it means to you. And I've met many clients in Housing First, and it works, okay? And Really delighted to be joined by Dr. Sam Samberis today. I was earlier on in the week, I don't get to say this often, but earlier on this week I was in Paris at an EU housing ministers meeting, which is the first time since 2012 that the housing ministers of Europe have actually sat down together. And right the way through that, and that's part of the platform on eradicating homelessness, the Lisbon Declaration that I signed on all of your behalf to eradicate long-term homelessness in Ireland by 2030, along with our European partners. And this has been taken very seriously within the European Union under the direction of Commissioner Schmidt on social integration, and also the French Minister of Housing, Minister Vargon. And a really excellent meeting it was. But what was really telling here, and it's great to have Dr. Sam here, to refer to him as Dr. Sam, we have another Sam McGuinness here, so to make a distinction between both, is that the number of countries across Europe that reference Housing First as their approach to tackling really difficult, complex issues for people with addiction, mental health, and homelessness. And to have you sitting here in the room as a testament to the work we're doing, and actually from you who pioneered this work in the States, to see it embedded right across Europe and to see it expanding here in Ireland, to me is it's just fantastic. It's an honor to be here. So I really want to thank you for being here, Sam. I'm looking forward to hearing what you have to say. Look, fundamentally, Minister Feehan has mentioned that this government's committed to eradicating homelessness. It's a difficult issue. We need to build more homes, and we're doing that under Housing for All. We're going to build 300,000 new homes between now and 2030, 90,000 new social homes, brand new builds, 54,000 affordable houses, and the rest private homes. But we're going to expand Housing First. We're going to support our NGOs, many of whom who are here in this room with us today, and many of others looking in virtually. And all of our NGOs have been incredibly supportive of the work that we're doing. We've established the National Homelessness Action Committee, which interdepartmental, as Frank mentioned, justice, health, housing, our NGOs as well, all feeding in, because it's one issue that we all want to resolve. And I want to tell you this, that tackling homelessness and reducing numbers and giving people permanent homes and the health supports that they need is our #1 priority above all, and that's across government. You have a situation here where we've Minister Feehan, Minister Donnelly as well, and myself, that are simply able to support the work that you're doing. And I thank every single one of you for the work that you're doing. And what we're going to do now is we've nearly 700, I like to round up, nearly 700 new tenancies sustained under Housing First, where the health supports are in place, the tenancy retention rate is exceptionally high, is really impressive. And we're going to do another 1,300 at least on top of that. And I know we all have the ambition to do a lot more than 1,300. And if we deliver more than 1,300, you'll have the support of this government and the financial support and the resources to deliver a lot more than 1,300. And I want that to happen. I want to congratulate, if I could, Rob Louth, our new Housing First National Director. Some achievement to get the office open on your second day in the job. But it's fantastic, and it shows the commitment to the expansion of this scheme. I have to say the Housing Agency, to the chairperson, Michael Carey, through Bob Jordan, who has direct experience in Housing First from previously being the director, that now is CEO of the Housing Agency, a fantastic board guided by Michael, and a really, really strong team here, that across government and across our government agencies, we're committed to this. And we're doing this, and any support at all that you need, you will get. Any roadblocks that we need to get around, we'll get around them, and we'll get around them together. Because just to conclude, colleagues, on this, some people look at the challenges that we have in housing and think that they're insurmountable. They're not. It's well within our ability and our competence, our knowledge, our expertise to make real progress, and we're making progress now. But 2 years of COVID. Look at what the country has been able to do, not just the government, more importantly, our society, all the tools and armory that government have had to tackle a global pandemic. And, I think even by any fair estimation, people would say that the response to COVID of the Irish society was very successful. Our health services working together. Look at those who were in addiction, how they were able to, many people who were shielded through COVID came out with better health outcomes than they had before going in. And I know through the work that Jim Walsh and the team are doing in the HSE. We're making sure that those gains that we've made through COVID, we're going to retain. And those gains are going to be embedded in the approach that we have on Housing First and its expansion. So I'm absolutely convinced, I'm a realist, not an optimist, I'm a realist, that we are going to make serious strides on housing and homelessness, and we're doing it now. And over the next couple of years, when people look back post 2025, they will see this period of time as a period of time where we delivered housing at a scale never done before, public housing at a scale never done before, affordable housing at a scale never done before, and where we really work towards the eradication of homelessness and looking after the citizens that it's our duty to help with, to help them get their lives back on track. So a real pleasure to be here with you today as Minister for Housing on this such an important day on the launch of the Housing First National Directorate Office. So Gurmina Mahbub Galar.
Thank you so much, Minister Feehan, as well. I must say, when I saw this harp next to the Housing First National Office, I kind of had a little moment where I realised that actually Housing First is now fully mainstreamed in Ireland. It's part of a government body. And I just want to thank you, Minister O'Brien, and you, Minister Feehan, for really your unstinting support and bringing it to this point, and your commitment to ending long-term homelessness. I also want to thank Dr. Samson Beres for going on the journey with us, and for travelling to Ireland to share this moment, Sam. I know this is a moment that you've looked forward to too. And I know that our chair, Michael Carey, the board and staff of the Housing Agency are hugely committed now to playing our part in this next phase of Housing First. And I suppose having the Housing First National Office within the Housing Agency seems really appropriate, given everything else that we do in terms of seeking to increase housing supply, acquiring one-bed properties, delivering training, awareness, good practice toolkits, and so on. So there's so much else going on in the Housing Agency that can support this office. So the Housing Agency is a good home for Housing First. And I suppose, Minister, just to be clear, I think that the government's commitment actually is really simple here in terms of Housing First, in the sense that everybody who needs it will get it. We have a figure of 1319 that was in a point in time, but we know that's a floor. And we know, unfortunately, more individuals may become homeless, and we may need to deliver more Housing First tenancies, as we did under the last plan. The other thing is Housing First is now available in every local authority in the country. There's a Housing First tenancy in every local authority and HSE area in the country. And as you said, over 1,300 tenancies will be delivered over the next 5 years. So when you add the 1,300 and the 700 you mentioned, that's 2,000 individuals out of long-term homelessness. And Housing First is a highly successful collaboration. I mean, I say this over and over all the time, but collaboration is the solution to complex problems. And the Department of Housing, I see Rosemary there. Department of Health, I see Jim and Durarka. The local authorities, the DRHE, the HSE, homeless service providers, approved housing bodies, Genio. There's a whole gamut of people involved in this collaboration, all pointing in the same direction. One of the things that we've done in the last 2 years as well is introduce a criminal justice strand of Housing First. So working with people in custody or on probation supervision who've also had an experience of homelessness, to ensure that they're not released from custody onto the streets. And that pilot has gone really successfully in Dublin. So one of the things the National Office will be doing is extending that across the country. Really important in terms of preventing people from returning to homelessness. The other thing I'd say though is, progress hasn't been linear. There have been, Minister, as you mentioned, kind of roadblocks along the way, setbacks. But I think what we've done is we've got together, we've developed workarounds, accommodations, and new protocols. Just to give you some examples, for instance, maybe somebody has an appointment with a mental health service. So it's very important that their case manager on the housing side knows about that. Now, that actually requires people to have protocols and share information together. Or simply in the primary care arena, that somebody would get more appointments than they would normally get, just to get open access to primary care. So everyone's played to their strengths, and there's 3 impacts of Housing First. And actually, in a way, the ending homelessness piece is the easier piece. So after 9 months in the Housing First tenancy, you kind of know whether that person is going to retain that tenancy. But the house provides the platform for recovery around the issues that people have experienced in the first place, you know, around mental health, addiction, and so on. Clearly, you can't recover unless you've got a place of your own. And then, you know, I think, Sam, you spoke to our board yesterday, we talked about social integration. The next kind of phase for people is to establish relationships in the community, to get employment and so on. And we're committed to that as well, to running an employment program alongside the Housing First program. And the fourth impact is system-wide, it's system change, kind of rebooting the way we do homelessness. If we look back to 2000, homelessness and integrated strategy, it was very much focused on emergency accommodation. Now we have a housing-led, housing first approach to homelessness in Ireland. And, you know, research carried out by the Dublin Region Homeless Executives shows that the Housing First client group, that, you know, kind of 1 in 5 individuals actually, you know, occupy about 2/3 of the bed nights in emergency homeless accommodation. So if you get that group to where they need to be, you essentially start the process of dismantling hostels and shelters, a really important goal in terms of, you know, achieving the Lisbon Declaration. I think in terms of, you know, when we talk, in a way, I suppose one of the things we've learned through the Housing First program as well is that the people who are long-term homeless using emergency homeless accommodation are the same people who use emergency departments and hospitals on a long-term basis, are the same people who are in and out of prison. So we actually have a common client group. And just to say, Minister, you signed the Lisbon Declaration and the commitments in Housing for All, the commitments in the Housing First National Implementation Plan. And I think the launch of the office today brings us another step towards achieving that by 2030. I just want to finish really by introducing Rob Lowe. I mean, as you say, I was the National Director of Housing First previously. So listen, I wanted to make sure we had somebody good for this, and I think we've got somebody, okay, yeah. Rob, first and foremost, Rob is hugely committed to ending homelessness. The values are so important here. He's come to the agency from Limerick City and County Council, where he was the head of homeless services, and we worked together over the last couple of years. He's played a pivotal role in the rollout of Housing First in the Midwest. And I also think that he's completely client-centered. He's completely focused on the needs and choices of the individual. So obviously, Rob, we're delighted to have somebody as talented as you taking up this role. And sitting beside you there, Grania, who has done a lot of work in the agency on social inclusion around disability and so on. And I know you're going to lead out on the peer support program. So I suppose without further ado, Rob, this is it, day 2, and you're on stage. Rob Lowe.
Now, how do you follow speakers as eloquent as that? And Sam hasn't even spoken yet. So the first thing I'm going to, okay, that's okay. The first thing I'm going to do is the clarity around my name. Everybody gets it wrong, apart from the Minister of Housing, in all fairness to him. I'm the same as the county, Rob Louth, very proud Louth man who I was adopted by Limerick City and County Council 19 years ago. So from that perspective, it's nice to get away. You know, I think I was due a break, but it's an honor to come up here to get into the role of National Director and to launch the national office. And I think there's a lot has been said so far about the importance of Housing First. And in fairness, I'm not going to cover old ground on that. But it is, and it's important to re-emphasize it with the ministers that the cross-governmental approach is huge. I've been in the industry 19 years. Some of you have been in it a lot longer. And to actually wait for this point in time, for the heads to be banged together or for whatever solutions needed to happen to make this a reality. And that's so important. And that has to be commended. There's a lot of stakeholders here, and I look forward to actually getting out there and working with all the stakeholders involved. And because we have a national office, and in fairness, huge shoes to fill in Bob and the great work that he has done before me. But as a national office, it's an entity on its own. It's an important standalone factor there with the support of the housing agency. But it's to align all the stakeholders. And I can't emphasize the importance of that, from the Department of Housing to the NGOs, to the local authorities, to the HSE, across the board. Just everything has to come together, and we have to align and center around this policy, because if we don't do that, we're at nothing. And that's where I'll be firmly focused over the next number of years. Yes, it's my second day, but why not jump in at the deep end? I think we all enjoy a bit of a challenge with that. Coming from a local authority, I have a certain perspective, but I've worked with NGOs, with Department of Health, HSE for most of my career. And I think we all know how we have to work together to get on together. But the Housing for All plan it's important to mention, just in terms of one of the biggest bottlenecks is the delivery of one-bed units. And I think Housing for All has put that on the right footing to actually have local authorities delivering housing plans to actually get that over the line. So I think that's critical. Bob had mentioned the criminal justice side of things, which is really important to actually take on as well. I could talk about numerous developments within the program and the implementation plan that we'll be touching on. But I think it's important to point out at this stage, the research that's happened in the last 3 years is critical to inform the program going forward as well. It's not that the 3 years has been wasted. We're going to learn, we're going to continue to learn and really work with that. And Genio have been nothing short of fantastic in terms of their guidance to date and the experience that they draw on as well to get the job done, basically, is probably the best way to say it. So I'd like to say thank you to everybody involved in preparing for today as well, especially Julie and Claire and the team in the housing agency. And it's really nice on your second day to feel welcomed and warmly welcomed into the housing agency as well, which is really important. So finally, I'm just going to talk about each success in Housing First is built from discrete events that have taken place to ensure a permanent house is successful. This is happening every day, 24/7, 365 days of the year. And I think that's the critical message that I want the National Office to embrace and to take that forward, that we as a National Office can deliver confidence to the entire sector across the board, because without that confidence, we'll be struggling. And I think that confidence was delivered already with everything that's happened to date. And I think we need to keep working on that and take it forward. So on day 2, my door is open. I'm always willing to talk. I'm always willing to engage. And I think that's the message that I wanted to portray here today. So I'm going to introduce you now to Gráinne Johnson, who's my colleague. So it's an office of 2 at the moment. It's going to expand. But Gráinne has already been doing some great work on the peer support, and she's just going to talk a little bit about that. Thanks a million.
Good afternoon. My name is Gráinne Johnson, and I'll be taking on the role of Peer Support Project Coordinator within the new Housing First office. The project coordinator will strengthen Housing First in areas of peer support, social inclusion, monitoring, and the community of practice groups. This will be achieved by establishing additional peer support specialists, by developing community support frameworks for existing Housing First tenants, by establishing a tenancy progress monitoring process, and also by continuing to develop and support the Housing First community of practice groups that are already established nationally. So I'm looking forward to being part of this important new team and the Housing First National Office. Thank you very much.
Thank you. We are honoured today by the presence of Dr. Sam Tzimbertis. He's a legend in his field, the creator of the Housing First model. Sam has extensive experience of supporting its successful introduction in a number of countries around North America, Europe, Australia, New Zealand, and elsewhere. Sam is the CEO of Pathways Housing First Institute, which provides consultancy and training to governments and NGOs and charities across the globe. This week, Sam has been here working with the Peter McVerry Trust and their colleagues who are involved in the Housing First programme. Having him here with us today to share his experiences, and having him here over the last few days when we've had a number of engagements with him, has been a remarkable opportunity for all of us. Sam, can you please say a few words?
Thank you very much, Michael. Ministers, ladies and gentlemen, great honor to be here. It's such a spectacular occasion, and I want to articulate why I think this is such an important moment for Housing First in Ireland and Housing First possibly as a model for other European countries. Minister mentioned that Housing First is a widely practiced across the EU, but few countries have achieved a national footprint for Housing First with the aspirations and goals that you're articulating here today. The reason that many countries adopted are the ones that you've already heard. Evidence-based practice, great outcomes for housing stability. Right now in the cohort of the 700 or so that have been housed in the initial pilot here, there's about an 87% housing retention rate. So it speaks for itself. And it's the evidence, in addition to the moral and values and commitment as a society to help the most vulnerable, it's really the evidence that has pushed the dissemination and implementation of this program across all these different countries. But if you look at the data also carefully, what we do achieve easily and well is housing stability. And what we struggle with and don't have as good a record with is the other recovery-oriented outcomes: reduction in substance abuse, mental health improvement, employment. We do no less than the control group. We do a modest job of that. But if there is room for improvement, and there is, it is in these areas that come after housing. So the collaboration between health and housing is so important on so many levels, because without housing, we don't have the retention rate. But without the collaboration of health, we don't have the opportunity to have these other secondary and clinical improvements. It's the other thing about Housing First, in the adoption of it, I mean, people have talked about, how it works and who it serves. And one of the things that you're also bringing into this, whether it's articulated or not, is a shift in the way that we think about homelessness. Homelessness is a disservice as a label to the people that are described as such. For me, homelessness is really a category that we used to use in the mental health services back in the early 1900s, when people were severely mentally ill and we didn't know what to call them diagnostically. Everybody was schizophrenic. It was sort of a grab bag diagnosis. You don't know what to do. And then as we learned, perhaps people had a different kind of illness. They had Tourette's, that was pulled out. They had cycling mental health problems. Oh, that was called bipolar. So there was a kind of a differentiation of an increased appreciation of the subtlety of this. Homelessness is one of those categories that actually hides the problems of people rather than identifies them. And people end up homeless, not because there's something about them, but there's something about the systems, non-systems of care that have failed them along the way. Not being helped in school, being in the hospital, being discharged to homelessness, leaving care and having nowhere to go. Criminal justice, once you're homeless, you're in and out of jail just because you're poor. And we have set up a system of care that is looking to improve people in order to get them back to housing. If you're really adopting the principles and practices of Housing First, you are actually choosing to shift to correct the systems that keep continuing to create homelessness, stopping the blaming of people who end up homeless, and figuring out at the top how to improve so that the people that we have not been successfully able to serve can actually come back amongst us in the community. So it's not about changing people who are homeless to do better or be better. It's about working together at the systems level to create systems that we don't lose people. That's part of Housing First, and that's something that, you know, all of the effort to change the individuals we're working with would have to shift to a systemic approach where we're trying to embrace solutions that are actually about improving the systems that we're operating, to have them be flexible, nimble, and person-centered in order to work with the people that we're working with. It's also a model that insists on client choice and empowerment rather than compliance and following the rules. So if we're going to have recovery and if we're going to have people empowered, it's not a charity model. It's an empowerment model where people have choice and voice about what they want and what they're doing it, and for systems to be flexible enough to accommodate that. So it's maybe more than we bargained for. We know it works. We can get people out of homelessness right away, but if we're looking to really change, the change is us, not them. So that's part of also this launch. And if we're going to implement this seriously, I think, you know, we have to kind of focus on those kinds of issues. There is no better way to do this than what you're doing right now. I mean, it's unprecedented. The examples I've seen in other countries where health and housing work together. The US has a terrible record on homelessness, but they have one shining example with veterans where health and housing work together, and they have ended veterans' homelessness in over 83 cities. It takes this collaboration, and collaboration in place and the sustainment now that you're committing to is taking Ireland over the hump of having gone from a pilot to something sustainable in this new housing agency. That is extraordinary, and it doesn't happen in many countries. There have been many, many trials of Housing First that I've participated in, and they've never gone beyond pilot to an implementation mainstream stage. So you're on the cusp of doing something really incredible, and I commend you on it, and I really look forward to the outcomes. Thanks very much.
So we'd like to thank you, Sam, for going on the journey with us. And the only proof, I think you will agree, of the Housing First programme is whether the permanent housing and supports that we provide actually work for the people that participate in the programme. And that's what we're going to talk about now. So we're going to invite Gary and Bernie to come up here. Gary has been a Housing First tenant for 2 years. As we all know, it's not easy to public speak. So, but we're all friends here, Gary. We just want to hear from you, your direct experience, okay? Yeah. All right, Gary.
Hello, my name is Gary. I'm 35. I first came across Housing First a couple of years ago through Peter McVerry. I was in and out of homelessness and prison since I'm 18. And over the past few years, I was in Crosscare, and then I heard about Peter McVerry Trust. So I said, I'll give that a bash, see if it's better than the other ones I was going to. I went to Peter McVerry's and went to one in Ellis Cay. I stayed there for over a year. I was happy with that. And then I got a chance to go to Cabra. So Cabra was a much better hostel. And it was there that we came across Sean. Sean worked with the Peter McVerry Trust on different levels. So we got down chatting to him one day, and he asked me if a place come up, would I be interested? And I didn't know where the place was, so we had a few more meetings, and then he came back to me one day and said that it was in Tallaght, and I'm from Tallaght, but it was out in City West. And he asked me, do I want to get my hug? So I said, yeah, well, I'm from Tallaght, so it's only natural I'm going to take an apartment out in Tallaght. So he brought me out, showed me, and yeah, took it from there. And then the Housing First team, I'm out there 2 years now this month, thank God. And the Housing First team, I couldn't have asked for better people. They come to me every week, they ring me. If I need them out with me, they'll come out to me, you know, anything in any aspect what I needed, they'd come out and help. And yeah, I'm just so grateful to have them there, because it's taken a lot for people to come out of homelessness, and the same as Housing First is the real trailblazers. I say, you know, the real trailblazers to help people get out of homelessness. So it was one of the fortunate ones to get it. And yeah, I couldn't be so happy. I've been on Pat since 18, since I'm a child. I've been an addict, on and off drugs, and since I'm 18, in and out of hostels, in and out of prison. Then for the past 2 years, the bit of stability I had was the Housing First, the apartment that they got me, because it was more of a lifesaver, because I was on methadone, and within 4 months of moving into that house, I was completely clean off methadone. So it was after giving me a good outlook on life, a more positive outlook on life. And my key worker, she's helping me look for work now. So every week she comes up to me, we sit down, see what sort of jobs it suit me. And other ones I wouldn't, I would strive towards making them work for me. But yeah, she comes out every week, we set up a few things and send them off. So yeah, Housing First has been a godsend. It's helped me along my way. And I'm sure it's going to help thousands more. Well, hundreds, if not thousands. So I just want to thank you for giving me the opportunity of having such a good place to live out there. Thank you.
Gary, thank you very much for sharing that experience, an inspirational story, and all the reason why we're all here today. And fabulous to hear you, and fabulous speaker. Ministers, Sam, all the other speakers, thank you very much for your time here today. I can reinforce the message that Bob was sharing with you, that the Housing Agency is entirely committed to ensuring that this is an exceptional success. We will, as a board, allocate whatever resources are necessary to make this work and make the greatest impact possible, with the support of the departments. And wouldn't it be great if this became an international beacon of ambition and beacon of hope for other countries that could follow in the footsteps of Ireland's efforts to eliminate homelessness. Thank you all for being here today.